My name is Christine Eng. I'm a pediatrician and a medical geneticist, and I'm professor at Baylor College of Medicine and chief medical officer of Baylor Genetics. And at Baylor Genetics, our passion is to help patients with rare diseases get the answers that they deserve. So we deal with rare disease populations, and these individuals often go through what's called a diagnostic odyssey. So this is where they may present with a certain constellation of signs and symptoms that can be very difficult to recognize. And so what we offer are some tests that clinicians can turn to when they need some help in making a diagnosis. So some of the tools that we use in the laboratory are next generation sequencing, so tests that are comprehensive like whole exome sequencing and whole genome sequencing. And we also do tests such as chromosomal microarray analysis, but all of these tools can be used together to try to come up with an answer for patients that have, in many cases, been searching for many years to find out what is the underlying cause of their condition. Genetics experts are pretty rare. So we talk about rare diseases, but physicians that are trained in genetics are pretty rare as well. And that's why it's really important to have these tools where you don't have to be a genetics expert. You just have to be an astute clinician with the tools available, to help you make these diagnoses for, what could be a condition that you may see once in a career. So I think that's another reason why these types of comprehensive tests can be very useful in settings where a clinician may never have seen a particular diagnosis. So we at Baylor Genetics have been very busy this fall. Fall is usually the season where there are a lot of medical conferences. And so we've been going to several different conferences this fall to kind of get out the message of whole genome sequencing and how it can help patients with rare diseases reach a diagnosis. So one of the meetings that we went to this fall was called ICONS, and that stands for the International Consortium of Newborn Sequencing. And this is an alliance of many different types of healthcare professionals. So there are physicians, there are stakeholders from the states that do newborn screening, and everybody is looking for what might be next in newborn screening. So what we wanted to present was our experience in a related area to newborn screening, which is trying to diagnose newborns in neonatal intensive care units who may be presenting with a genetic diagnosis. And so this is to inform that conference and those conference goers of the types of conditions that they might see if they were to bring sequencing into the broader population at the newborn level. So what we did was we took a look retrospectively of our rapid WGS program. So at Baylor Genetics, we offer rapid whole genome sequencing with a 5-day turnaround time. So this is quite an early diagnosis that can be made for patients who are, let's say, in the intensive care unit, and they're looking for a diagnosis in a very expeditious way so that more informed treatment can then be instituted. So we did a retrospective review of our rapid WGS cases, and most of these cases are from the NICUs. We had about 56 patients that had a positive diagnosis from this test, and we took a look at how these patients were impacted by the results. So of these patients, the median age at testing was about 3 days of age. So these are babies that are born with types of problems that might lead a clinician to suspect a genetic diagnosis. So most of the time, these are multi-organ system problems. They could have pulmonary problems, they could have cardiac problems or neurological problems. So clinicians, when faced with newborns with this kind of constellation of findings, often turn to genetic testing. And in this case, rapid whole genome sequencing was chosen. So with the 5-day turnaround time, the 56 patients that were positive in this study received their diagnosis at a median age of 8 days. These diagnoses ranged from, and most of these, of course, are rare conditions such as Kabuki syndrome, Cornelia de Lange, Charge syndrome. Several other diagnoses were made in this cohort. About 80% of them had single nucleotide variants because whole genome sequencing can pick up a variety of different types of mutations. About 80% were single nucleotide and about 20% were copy number variants. We also took a look at, and this is probably the most important, of what the impact was on their medical management. Of the patients that were positive, about 62% had a change in their medication. So while they were waiting for the results, they may have been treated with one approach, but once they received a diagnostic result, the medication changed. About 60% also had a surgical procedure. About 9% had a specific dietary change, and then about 60% received other types of care, such as supportive care. So this goes to demonstrate that, a diagnosis in the early stages of presentation can really affect how a patient is treated in their course of management. We also took a look at comparing whole genome sequencing to other types of testing that are currently available, such as newborn sequencing panels. And we found that whole genome sequencing was more effective at finding a diagnosis. So in cases where we compare the diagnosis that could be made by whole genome sequencing versus a panel, 73% could be made by the panel, but would have been missed if only a panel were performed. So this study was to demonstrate the utility of using whole genome sequencing for these patients that are presenting early in life, but are really in need of a rapid diagnosis to give them the best possible chance at a good outcome. The work that we do in the NICUs is, very specialized for patients that have a presentation that might lead their physician to think it's genetic. What's being looked at in the future is to kind of change the paradigm of newborn screening, which is done by a variety of different methods right now, and to apply sequencing in that setting. And that's to pick up the broadest possible range of conditions that could affect a newborn. Right now, there are specific conditions that are being tested for, but with whole genome sequencing, the idea eventually, and of course, this would have to, be very gradually introduced. We would have to understand the risks and benefits. There are many, many issues with knowing an individual's genome from the time they're born. So, this is why organizations like ICONS are existing, is to understand all the possibilities here, all the risks, all the benefits, and make sure that we approach this in a careful way. That being said, the cost, obviously is something that as sequencing costs go down, we have to realize what the benefits are in terms of overall health improvement and overall just more targeted care for those that need it. We are in, I would say, just an exploding time for the generation of treatments for genetic diseases. We have treatments for neurologic conditions. We have treatments for bony conditions that would have been, not really thought of 20 years ago. And this just is continuing to accelerate. So not only are there specific treatments for many genetic diseases right now, but there are clinical trials for other treatments that are being considered, that are being worked on in pharmaceutical companies and academic laboratories and being brought into the clinical trial arena. But without a specific diagnosis, these individuals could not join a clinical trial. So the key is to make a diagnosis. And I remember when we started whole exome sequencing, 10 years ago or so, this was really brought to us in a very dramatic fashion of a local patient, who had a genetic condition that he had been through the diagnostic odyssey. Finally, through the exome sequencing, a definitive diagnosis was made. and he was able to join a clinical trial that just opened, something specific for his condition. So it is important to have a name, to put a gene on the condition that you have. Maybe there's a treatment today, but maybe there'll be a treatment next year. But then there'll also be more targeted management. You may know what to expect. You can contact other patients with the same condition. There are many advocacy groups and patient support groups where patients, meet other patients with the same condition, and they can start to understand what the future may hold. And then, many other types of avenues open up when you have an idea of what the future may bring.